The documentary, Can Central High School Save America?, demonstrates how good public schools are essential to graduating citizens who can keep the country prosperous and safeguard our democracy. This bonus feature is an expanded interview from the program with a student who graduated from Central in 1968 with an interest in medicine. Julie Warner Wanager was a Kiltie, on the speech squad, and a member of the school orchestra. She appreciated the way her teachers at Central let her experiment.
My chemistry teacher, he knew I wanted to go into nursing and medicine, so he let me do a science project that year. I would go get blood samples during school. He'd let me out, and I'd go to the vets and get different blood specimens from dogs, cats, any kind of animal that he might have there. And then I came back to the school and I would use the different blood samples to determine if there was a different spectrometry for each blood sample. My results were negative, so my hypothesis didn't work. But I think in allowing me to do that, to think outside the box and allowing me to try something, even though he probably already knew it wasn't going to work, was very enlightening.
Julie Warner Wanager became a nurse and got a master's degree in public health. She worked in emergency medicine, pediatrics, infection control, and neurology. During the Gulf War, Julie served as a Navy nurse in a combat zone mobile hospital during Operation Desert Storm.
They knew that if they destroyed the medical units, that would demoralize the soldiers. They tried to keep us well hidden. But even with that, we did have shrapnel that fell on the tents and constant bombing.
After the war, Julie became a hospital administrator, improving medical care quality. Looking back on her high school days, Julie appreciated what Central gave her and expressed some concerns about schools today.
I think I learned to see things differently, to work with a lot of different types of people. Because in junior high, it was mostly my neighborhood kids that I stuck with. In high school, I was allowed to reach out and see different people and work with those different groups of people. The Kilties was a very well-disciplined group of girls. We had to meet certain grade point averages. We met every morning at 7 o'clock in the morning to march and prepare for any kind of parade or ball game that was going to happen that week. I still think about some of the teachers that I had. Taking speech classes helped me in preparing for my master's in public health, because in my master's program we had to get up and give presentations. My dissertation was all oral. I don't believe, just from my husband being a teacher and seeing some of the experiences that he had to go through, and working as a school nurse, seeing the kids, I just don't believe they allow the creativity that we were allowed. I think, number one, that we need to give the schools the money that they need. They sold the lotteries as school money, and then you find out it's watered down by all of these other things, and by the time it gets to the school, it's maybe not even a fifth of the total amount that was given. And all of our schools need to be equal. I mean, they've shown where kids that are even foster home kids, how some of them have blossomed and had a very high IQ and gone on to be very successful individuals. And I think all of our kids deserve the same type of education.